I can take those. Yeah, this is again a summary, just 2 slides. Perimenopausal bleeding, structural, non-structural, malignancy and ovulatory dysfunction more common in this population. History, physical examination, sonohysterography, endometrial biopsy. This is initial evaluation. Hormonal treatment, GnRH analogs, procedure, hysteroscopic polypectomy, endometrial ablation, uterine artery embolization, hysterectomy. Here, I would want to initial evaluation, I would lay greater emphasis on ultrasound, as a matter of fact, instead of sonohysterography. Ultrasound is important. So that is it. जी अभी कोई सवाल है तो बताएं. आगे चलें फिर. We'll cover a little bit of postmenopausal bleeding because time will not allow us to complete this today. So we already have defined this. These are some of the figures which you need to remember. That incidence 10% immediately after menopause. Patients with postmenopausal bleeding have a 10 to 15% chance of having endometrial carcinoma. 15% को बेशक उड़ा दें, आप 10% याद रखें जरा. हाँ ये लगा देने ताकि इससे पता चलता जाएगा, कोई मैसेज आ जाता है. ठीक, ये नीचे से कम कर दे. ठीक है, ओके, ठीक है. हाँ जी. And evaluation to exclude cancer in the genital tract or precancerous lesion. Now, this is important. Exclude cancer in the genital tract, not only from the uterus or the endometrium. You see, if there is postmenopausal bleeding, we need to emphasize this fact that it is not only the endometrium, although more common is endometrium, but that is not the only source. So our approach has to be comprehensive. And prevalence of endometrial polyps and hyperplasia is 40%. Now, in this segment of my presentation, I will be referring to some meta-analysis, some studies, which I would emphasize that as postgraduates, you people should be aware of. Why? Because you have to argue. You have to argue your case like a lawyer. That if you say that this is what you would advise the patient, or this is the line of management that you are going to take, then what is the evidence for that? Why do you say so? It is not that you just think it is like that. Either it has to be backed up by some physiological or pathological fact, or it needs to be corroborated with certain studies, the results of those studies and what they show. And therefore, I have made a few references, but you can kind of keep track of those and remember them, and also find out for yourself some of the references related to that. Now, postmenopausal bleeding usually attributed to an intrauterine source, but as I said, that it is not the only source. It may arise from the rest of the areas of the genital tract, and that is something which needs to be assessed and ruled out right at the outset. Hematometra may also result from cervical stenosis. These are the various causes what can happen. And so genital tract, as well as those structures which are in close proximity of genital tract, like the lower urinary tract and the rectum. So bleeding from urethra, if there is, you see, in routine urine examination, you find that there are RBCs, then not necessarily they are coming from the urethra or the bladder or the renal tract. They may be, the urine may be contaminated with the blood from the genital tract. So this is what we usually want to rule out when we look at the urine report. Similarly, if there is bleeding from the genital tract, we also need to rule out bleeding from either the lower urinary tract or the bowel. So that would kind of make it comprehensive, that you perform pelvic examination and you visualize cervix and you rule out cervical causes of bleeding. This is an important paper which was published in Journal of American Medical Association Internal Medicine in 2018. This shows a systematic review and meta-analysis, and the reference is given here below here, and that says the prevalence of postmenopausal bleeding in women with endometrial cancer. That is its premise, that in postmenopausal women with bleeding, there is a certain incidence of cancer. And then the risk of endometrial cancer in women with postmenopausal bleeding. So how many cases in postmenopausal bleeding would be of endometrial cancer, and vice versa also? In this systematic review, a systematic review is that which takes into account large number of, or few studies, more than one study, and they look at the data, and then from that data they then reach their conclusions, that how many were in favor of this or against that, and what was the evidence given in those. So the collective number of patients was more than 40,000, and there were 129 studies that this meta-analysis took into consideration. And this is an important figure here in the last segment here, that only 9% of women with postmenopausal bleeding were diagnosed with endometrial cancer. So the incidence of endometrial cancer in women presenting with postmenopausal bleeding is 9%. On the other hand, postmenopausal bleeding occurs in 90% of the patients who have endometrial cancer. So you see, now what was said in the first segment is amplified or explained here, that now how is the incidence 9% of those who have bleeding, and postmenopausal bleeding is endometrial cancer has overwhelming element of postmenopausal bleeding. Risk factors generally, there is a long list that we looked at, but obesity, nulliparity, unopposed estrogens, polycystic ovary syndrome, these are something which should be said or mentioned right at the outset. And this, of course, is the most common gynecological malignancy. But again, the rates would differ from places to, most of these studies, they come from the West. Now, if you look at the developing world, maybe cancer of the cervix is a little on the higher side, because in the developed countries, because of screening and because of vaccination for HPV, the incidence of cancer of the cervix has come down. And then ovarian cancer is also quite high because there is no screening method as yet. But still, having said that, endometrial cancer is the most common gynecological malignancy over there. These are again risk factors list. But important thing in these risk factors is that whereas the incidence of endometrial cancer in postmenopausal bleeding is around 10%, which is in that meta-analysis, you can refer to that meta-analysis and say that according to that, in over 40,000 patients in 129 studies published in American Journal of American Medical Association in 2018, this was the reason. Now, if you back that up like this, then you have 9%, 90%, etc. But the other specific conditions which are associated with endometrial cancer are that patients who are less than 50 years of age, the incidence is comparatively less, 1%. And those who are above 80 years of age, 25%. So age has some relation to that. Although 50 and 80 are two extremes of kind of age for endometrial carcinoma, as we given, because the peak incidence is at 60 years. But that shows the relevance and association of age with incidence. And secondly, it's important here that postmenopausal bleeding and obesity, the incidence is 18%. And postmenopausal bleeding with diabetes, it is 21%, and obesity and diabetes, 29%. So those are very important risk factors, obesity and diabetes. Transvaginal ultrasound in diagnosis of endometrial cancer is that has a pivotal role. And in 1980s, transvaginal ultrasound transducers were introduced and widely used in evaluation of postmenopausal bleeding. It has the advantages of being non-invasive, and obviously, therefore, it is more acceptable. And we know that during menopause, the endometrial thickness is, now this is quite an interesting phrase, endometrial thickness is very thin. So endometrium is very thin in postmenopausal women. And increasing thickness of the endometrium reflects a greater likelihood of endometrial carcinoma. TVS reliably assesses thickness and not only thickness, but it also gives you its relationship with the myometrium, how is the interface doing, and then it also measures thin endometrium, even thinner than 4 millimeters. And an endometrium which is less than 4 millimeters is unlikely to have endometrial cancer. So a kind of cutoff point is at less than 4 millimeters. And because this ultrasound can only suggest, it does not say that the pathology is there, it only suggests. And further confirmation would require endometrial sampling and cytological and histological proof of that. And therefore, this is an important question, that what is the cutoff line? Where would you do that? And where would you stop it? And where would you say that, all right, we are not going to pursue this case any further? So this is 4 millimeter line is, and below that, it is not recommended that you carry out endometrial sampling. Now we come to again other meta-analysis. This is the one in which there were almost 6,000 women and 35 prospective studies looking at transvaginal endometrial thickness with endometrial histology. When they looked at a cutoff line of 5 millimeter, less than 5 millimeter, then the probability from 10%, because we know in postmenopausal bleeding, the incidence of endometrial CA is 10%. But if this is the line, then the endometrial cancer rate was reduced, probability of that was reduced to 1%. So there is that relationship between the endometrial thickness. And so even at 5 millimeter, it is 1%. So thinner the endometrium, lesser are the chances of diagnosis of endometrial cancer. Therefore, expectant management without the need for tissue sampling is recommended for these women. Now, this is the conclusion of this study, meta-analysis, which looked at 35 prospective studies of transvaginal ultrasound. Then one study of follow-up of women with postmenopausal bleeding and end thickness of less than 4 millimeter. That found none of the women with the expectant management developed cancer over 1 year of follow-up. So 4 millimeter पे कोई नहीं था, 5 millimeter पे उनकी probability 1% थी. And then there was this comprehensive systematic concluded that 5 millimeter or less rules out endometrial pathology with a high degree of certainty. Not complete 100% surety, but with high degree of certainty. So this is the kind of approach that you as postgraduate students need to have. We are not finished. There are others. Now, this is the other side of the coin here. This is against those. This meta-analysis found that endometrial thickness measurement does not reduce the need for invasive diagnostic testing. इनका conclusion ये था, और ये नीचे वाला जो है, it was concluded that previous meta-analysis on endometrial thickness measurement have probably overestimated its diagnostic accuracy in the detection of carcinoma, and therefore these two meta-analyses, they recommend further assessment. And then we also need to realize that in many cases, proper assessment of thickness and morphology by ultrasound is not possible. For example, if the uterus is deformed with fibroids and the endometrium is kind of pushed to one side, or the patient is too obese, or you cannot visualize adequately. In such cases, or if bleeding persists despite negative initial evaluation, alternative methods have to be employed, of course. Now, accuracy of endometrial sampling methods. These two slides were about the cutoff thickness of 4 millimeters. And you can quote these 3 meta-analysis or studies to say that 4 millimeter or less than 4 millimeter of 4 millimeter is the cutoff. Below that, you can reassure, you can. Now, if she remains symptomless, she doesn't has any bleeding, then she wouldn't need any further workup. But if she comes back with bleeding, then she will need that. And then मेरा ख्याल है यहाँ पे हम रुक जाते हैं, आज का टाइम हो गया, और हम फिर इसके बाद बाकी जो है वो हम इसके आगे चलेंगे कि एंडोमेट्रियल सैम्पलिंग जो है वो कैसे की जाती है, क्या होगा और इस तरह से होगा. ठीक है, अभी तक के जो स्लाइड शो नहीं, क्या है, स्लाइड एग्जिट चले. ठीक है जी. Any questions? Which application group also क्या? In WhatsApp group. Slide, okay. ये मैं करूँ. असल में ये मेरी जो है ना, इसका मैं थोड़ा सा आपको एक और रुख इन स्लाइड्स का दिखाऊं. ये स्लाइड्स, अभी हम स्लाइड नंबर 50 पे हैं. वैसे ये स्लाइड्स 115 हैं, लेकिन सारी वो उस तरह से नहीं है, क्योंकि ये आगे जो हैं ये ख़त्म यहाँ पे होता है, स्लाइड 65 पे ख़त्म होता है. लेकिन ये जो आगे 7-8 स्लाइड्स हैं ये भी इम्पोर्टेंट हैं यहाँ पे, और आगे भी काफ़ी सारी हैं, बट वो इतनी रेलेवेंट नहीं है. ये जहाँ तक हैं, when we finish this topic, I will put this finalized presentation on WhatsApp, right? Right. No more questions. Thank you.